So when we're looking at the management of ADHD, it's very important because we try to optimize the child's social, cognitive, and emotional functioning, and to develop, to prevent the development of secondary emotional distress or psychiatric disorders. So, like Claire mentioned, there's lots of comorbid disorders that exist with ADHD, such as depression and anxiety. So we try to prevent those disorders with management, and then also to allow the child to reach their full potential. Sorry. Okay, so if we look, thank you. If ADHD is not managed correctly, this is what it's more than likely to lead to. So we can see over here criminal behavior. A lot of times children drop out of school and they go into dodgy, criminal behaviors, substance abuse, also like Claire mentioned, in order to feel better about themselves and their circumstances. They go on to maybe drugs or alcohol. Teenage pregnancies. I actually did an article not long ago about teenage pregnancy and ADHD, and we found that girls with ADHD are 5 times more likely to fall pregnant in their teenage years. And then you get problems with gambling or poor motivation, and also very complex learning difficulties that might develop later on. So very important to try and treat and manage ADHD as early as possible. Okay, so then further, going on further with the management, if there are symptoms of ADHD that are considered mild and it's causing minimal impairment in a child's life, or if they are uncertain of the diagnosis, or for whatever reason a parent does not want the child to go onto medication or treatment, or an urgent response is not required, then there are alternative ways of managing ADHD, and the child will then go on to a behavioral program. So let's just continue here. So the behavioral program usually consists of therapy, educational support, addressing potential stresses, and lifestyle. So if we look at therapy, it would usually involve parental guidance. So this would basically teach a parent or assist a parent with how to deal with symptoms of ADHD with their child and their behavior at home and school environment. It also works on the child's self-esteem, as we know, because children are receiving a lot of negative feedback all the time. It really negatively affects their self-esteem. And it teaches them how to manage their emotions. So like we mentioned, when a child has ADHD, it's often very difficult for them to manage their emotions. They often cry a lot. They have physical outbursts. So that's what therapy would entail. And then in terms of educational support, children would then receive learning support for those that are having difficulties, and classroom intervention, and just teaching them coping skills in the academic setting. And then in terms of addressing potential stresses, sometimes at home, there are stresses that are occurring. It could be divorce, it could be unemployment. So we look at what is happening within the child's environment that might be causing issues over there, and dealing with conflict and bullying as well. And then, of course, lifestyle is very important. It's important that children live a balanced life, so they have time for exercise, maybe engaging in a sport or hobby that they really like. Nutrition, so eating a high protein diet, maybe of fish, meat, eggs if you can. And omega-3 is also quite good for children with ADHD, and you'll find that usually in your fish and your nuts. And then sleep, it's important for children to get at least 8 to 10 hours of sleep for them to be able to function optimally. And then screen time as well. So with screen time, it's important that at least an hour before bedtime, that children turn off all electronic devices, turn off the TV, the cell phone, because it's just a good way for the brain to kind of calm. Um, yeah, because what they did find in research is that when you are looking at your cell phone, and I know a lot of people use either the TV or cell phone to fall asleep, that actually activates and stimulates your brain. So you won't get as good a night's rest as you're supposed to. So at least an hour before the time, just so that you can become calm. Yeah. Anything else on that? Fine.
Brilliant.
Okay. Okay, so ADHD and medical management, if we're looking at this, medication does not unfortunately cure ADHD, but it does help to treat the symptoms of ADHD. So it improves the way the brain manages everything. And it's very important that medication should be monitored carefully and adjusted for every child. And that is why we recommend that the child does not just stop medication. At times, people complain and they say that their child is having problems with their appetite, or their moods have changed, or there's problems with sleep. And so if things like that does happen, then it could mean that perhaps the medication type is not correct, or the dosage is incorrect, or the diagnosis is even incorrect. So in such instances, it would be better to go back to the medical officer, the doctor, and just adjust that medication. Okay. And then Claire did touch on some of this in the previous slides. ADHD does look like other difficulties. There are comorbid disorders that occur with ADHD. For example, visual difficulties. So if a child has trouble, for example, seeing on the board with their vision, that will look a little like ADHD, because they might become restless, or they might appear like they're not understanding their work. So it might become challenging for them. I think Claire mentioned, was it 30 or 70% less vision that you guys saw with the one child? Was it 30%?
Yeah, it was 30% vision. A child in grade 7, they picked up a child in grade 7 with only 30% vision. And unfortunately, the child had already been through most of his schooling, not being able to see properly. So, of course, she wasn't coping academically.
Exactly. So that might lead to difficulties with learning. And then also auditory difficulties. So with hearing, if a child's not able to hear correctly, they will obviously struggle academically as well. And then, like Claire mentioned, sensory processing difficulties. So some children are very sensitive to loud noises, to light, to different tastes and smells, which may look similar to the symptoms of ADHD. And then if I just look at some of the other ones, ones like worms. So often we've had children in the past that have had worms. So, if you have an itchy bum, you kind of, move around. You fidgety. So that could also look like, the restlessness that you may experience with ADHD. And then the type of children we see, they experience very traumatic events in their lives, like death, abuse. And so those things, that type of symptoms can also look like ADHD, the forgetfulness, the looking like you're daydreaming in your own world, not being able to sleep properly. That could also really look like ADHD. Okay, so just to look at ADHD in the classroom, children with ADHD might appear that they're not hearing you. So they might look, when you talk to them, they might be looking outside of the window. They might look like they're not hearing you. They can be disorganized and forgetful, like you have your children that forget to bring their homework to class, forget to bring their sporting equipment for sporting events. They might be emotionally explosive. So a lot of times, children with ADHD, they either are the bullies or they become bullied. because they have difficulty regulating their emotions. And they are sometimes defiant and they break rules. So you find children running up and down when you ask them to sit down, and struggling with normal things. So just sitting and listening to a teacher, which may be easy for some children, will be difficult for the child with ADHD. And then you also have them often disrupting other learners while they're supposed to be working. But not everything is all bad with ADHD. Children with ADHD are actually sometimes very creative thinkers. They're able to think out of the box. They can be very successful, and some of them are actually able to perform quite well academically and to be able to solve problems. So let me just show you pictures of some famous people with ADHD. You can see very successful people despite the diagnosis. Okay, we will continue. So managing ADHD in the classroom, it does require a teacher to have lots of patience, to be very creative, and all of this can make a big difference to a child. If you're patient, if you take their needs into consideration, it can make a big difference. So as we also mentioned previously, ADHD does affect the way a child plans, the motivation of the child, the way they start the task, and following through with the task, as well as their working memory. So for example, if a teacher says to a child, please open your workbook and start writing on page 9, that task alone might be very difficult for a child because they're trying to take in the instruction, they're trying to filter out what is unnecessary, they're trying to maintain motivation to do that task and to manage their emotions at the same time. So that might be very difficult for a child with ADHD. And then here's just some practical tips for behavior. So it's important, positive reinforcement for a child is very important with ADHD because they need that encouragement. So just a simple, well done, that was very good, that can make a world of difference. And then if they are in an environment where change is going to be happening the next day, so for example, they might have a change in their classroom timetables, then just a warning to tell them, okay, there will be a change in your classroom timetable for the next day or the routine that they usually follow so that they are aware. Because sometimes changes can be quite unsettling for children with ADHD. Just listening to a learner and asking them what distracts them or what helps them. Sometimes children with ADHD, it's better for them to sit at the front of the classroom so that they don't fade away into the back. Or sometimes there are things in the classroom like posters or something that could be quite distracting for the child. So just to listen to what helps and distract them is also important. And then allowing time for movement, for body breaks. So like we know, children with ADHD, they become distracted very easily. They often have lots of energy, so they just want to, move around. So asking them maybe to go to a teacher's class and to give them a note or to run on the spot for 5 minutes or something to get rid of that extra energy is also a good way to manage that. And then to seat them away from sources of disruption like doors and windows. Often cars drive past and that is a distraction, or they see children or teachers. So that's just to seat them away from those type of things. And then to limit distractions in the classroom, like I mentioned, maybe some children, they don't like seeing a lot of posters in the classroom, clutter in the classroom. So to try and make it as neutral as you can. And then for some children, chewing gum is actually a good way because it's a sensory type of motion. So it helps them to focus by just being able to chew gum. And with some of them, if you give them a piece of press stick to play with, or some people prefer like Velcro underneath the tables or an elastic band that they can fidget with, it also helps them to process and to do what is required of them. So here are some practical tips for lessons within the classroom. So you can start with setting behavioral expectations. So if you tell the child, okay, if you work for a nice 15 minutes, then you can have a break and you can play outside or something like that. And then to summarize the lesson before you start, so to give them a little introduction about what the lesson is going to be about, what they can expect. And then to present information in different ways. So some children are more visual learners, others prefer written, others prefer even music. So to maybe get creative with the way in which the information is presented to them. And then using step-by-step instructions, even if it means you have to repeat and go slowly, just to make sure the child is on track. And then you can prompt them to stay focused. So we had some teachers in our previous training that said they would just touch the child on the shoulder, or they would click the fingers, or they would use a secret code word so that the child knows they need to continue and to stay focused with the task. And then constantly checking for understanding is important, because like as we know, children tend to lose their way when they are busy. So just making sure that they understand. And sometimes an extra 2, 3, 5 minutes when a child with ADHD is busy with the task can be very helpful to them. And then constant communication between the child and the parent, the teacher and the parent, is also important, so that parents know what's going on at school and they know what needs to be done. Okay, and as we did say earlier, to give movement breaks. This is just an example of a structured day in the life, a plan that you can try and use to help a child with ADHD. And over here, we can also see the fidget spinners and beads that can help. These are just fidgets that can be used to help a child to focus while they're busy with tasks.